Good afternoon, everybody. My name is Keren Skubach. I'm a senior sales engineer from InterSystems, Israel, and I want to speak with you today about the Israeli Ministry of Health experience with our FHIR repository and FHIR SQL builder. They had some very exciting things to do with our FHIR repository. The Ministry of Israel, the Health Ministry of Israel has selected InterSystems FHIR as the FHIR repository for the state of Israel. And in Israel, we have a concept called an HMO, which is an organization which is both your insurance company and your healthcare provider. Okay, they'll give you the access to their doctors and labs and facilities and your day-to-day care. Okay, those are regulated by the Israeli Ministry of Health. And since the Israeli Ministry of Health has selected us as their FHIR repository, we have access, or we can get data that relate almost to everybody in Israel. Okay? Everybody in Israel has applied or is connected to one of the 4 HMOs in Israel. Everybody has insurance, so everybody is covered. So we have access to everybody's information over there. I'm going to speak about the ICDC, just to give you the background of where this project took place. The ICDC is the Israeli Center of Disease Control. Okay? Probably you would have similar organization like that in your country, and the basic things that this kind of organization needs to do is maintain public health. Okay, they need to have registry for diseases, chronic diseases, educate doctors and nurses and everybody in their country. And in our case, 3 of the most important things that relate to this project is the fact that they need to monitor infections. Okay, they need to have research on epidemiological transformation of viruses and contain public health, and they need to provide information. Okay, that information is the most important thing, because once you have the information, you can make conscious decision based on that information. So they've decided to build a system to manage epidemiological investigations, meaning when someone is identified as having a reportable disease, and there's a list of reportable disease, more than 100, like Ebola, for example, and of course, in our case, we're speaking about COVID, which is the last recent epidemiological issue we had to deal with. You need to understand that person who was diagnosed with that disease, where he has been, who he was in contact with, okay? And you need to maintain that contact, and you need to understand who he was in contact with in order to stop the spread, okay? So the data needs to be accumulated, needs to be diagnosed, and you need to decide upon that data to understand what you want to do later on with it. Once you identify it, the thing is you need to have the data as close to real time as you can. Because if I have information about someone that was diagnosed yesterday, in that day, he could have infected other people. Okay, if I know about it in real time, I can stop it in real time. So I can say that person is a student, he was in class at 8 a.m., okay, so we know who was with him at that class. We can issue a warning, or we can contact the person who was, or contact the school and identify everybody and get them quarantined in order to stop the spread. It's not foolproof, of course, okay? No, not everybody either say they are sick, okay? And not everybody adhere to the quarantine rules, but you can maintain it and you can have that information and you can stop it as early as you can. So the understanding of having real-time data is very important, and to understand that you need to make conscious decision based on that data, okay? So this is what we're speaking about. This is the architecture, okay, the Ministry of Health has implemented. If you look on the left side, you can see several kinds of information getting in various formats. It could be XML, it could be JSON, it could be an app where someone did a self-test at home, okay, and advised or put the information that he was diagnosed as having COVID, and that information is being transferred. It's transferred to FHIR, various certain tools along the way, okay? And then it is kept in the InterSystems FHIR server. What we're speaking about today is the last one. When you see the flow of the information, look at the last square, okay? There's an arrow above it, this is the relational query, okay? They want to look at the information that is basically sits within the FHIR repository in FHIR format, but they want to activate and do some analytics based on that with tools that do not concern FHIR, okay? From their point of view, they have something that can query information using SQL, which is why they use our SQL builder. Okay, so if you look at the FHIR point of view, those were the resources, okay, that were put inside the FHIR repository. So we had information about the patient, of course, okay, and the encounter and the condition and the document, and might be the practitioner who actually found out that that person was sick and so forth. So we have the information in the FHIR repository, but later on, we need to analyze it and get the information in SQL format. And how many of you have used the FHIR SQL builder? Great, okay. So you're probably familiar with that page, okay? This is the main page for the FHIR SQL builder. For those of you who haven't tried it, okay, let me just go through the 3 phases that you need to do in order to get your FHIR data as an SQL projection. The first one is to select your FHIR, the InterSystems FHIR repository, okay? You need to point to it and you have an analyze phase, okay, automatic analysis of the data that will tell you how many resources you have in that FHIR repository and each kind of resource, how many you have of each kind. You have like 10,000 patients, 200, I don't know, immunizations and so forth. So every resource would get how much you have of that resource, okay? After that, you would define your own transformation. And when I say transformation, everybody who's using transformation DTLs in the interoperability world, this is not the same, okay? It's not a DTL transformation. What you're doing over here is basically you're mapping or you're selecting FHIR elements and you decide that you want to project them outwards, okay? So I can select, and we'll see in a minute what can I select, okay? But I can select several elements from my FHIR repository from different resources, and I say this is what I want to see later on in my table. And the last thing I want to do is actually take all those elements and push them forward and project them as SQL tables. Okay? Once I have them as SQL tables, the whole world of SQL is open to me. I mean, everything I can do in the SQL world, like querying, of course, but views and so forth, I can do with that and using functions and so other things. So when I define a transformation, what you'll see on the left side is the list of all the resources I currently have in my FHIR repository. You see the number near each one of those? This is the number of resources, number of instances per resource that I have in the current repository I'm looking at, okay? So I have a number of, for example, 29 care plans, okay? I have 29 instances of a care plan resource in my repository. Later on, I can drill down into each one of the elements, into each one of those resources, and see those elements, including extensions, okay, and collections, and everything that resides within my repository. So I have a clear view of everything that I have inside, and I can decide which one of those elements I want to project outwards, okay, as an SQL column in my table. Okay, I can see what's in it, and I can select even the things inside, and I can decide what I want to do with it. Okay. In this slide, you can see that this is a slide from the Ministry of Health themselves, okay, which is why they showed. Remember the first slide I talked about HMOs? So in the Israeli FHIR profile, we have an HMO as an element, as an extension, okay, in the FHIR resource, in the patient resource. Okay, everyone in Israel is assigned to an HMO, so it's another element, and we want to project it outside as a SQL column. Okay, so this is what they did. They took all the information that was relevant to the information they want to push out, okay, including extensions that were defined in the Israeli format. Okay. Once we have that, I can basically connect using ODBC, JDBC, any other SQL tool in order to see the data, okay? So this is a simple example. I can do it using our own SQL manager, okay, which is pretty easy. But I can also do it using, I don't know, Excel to connect to an ODBC data source and see the information and decide what I want to do with that. But they didn't do it with Excel, of course. They did something much more bigger than that. They took the information and built a dashboard. Okay, so the dashboard I'm going to show you now is the public dashboard. Everybody can look it up and see the information. The data that you're going to see is a data that is 2 weeks old because I recorded it 2 weeks ago. And of course, they have other dashboards within, which are more for internal purposes, okay, for the Ministry of Health themselves. They don't expose all the data outside, but the data you're going to see here is basically that. Just a second. So you'll see the number of people who are currently diagnosed with COVID in Israel, okay, how many are hospitalized, okay, everything is being kept in the same FHIR repository. It's just being projected outside, okay? We can see the data based upon it. We can see analyzation based upon it, okay? Everything we can see here is actually based on data that was residing in the beginning as FHIR. Okay? I can see it according to an age group, I can see it according to sex, I can see it according to children and adults, or depending on whatever things they have created using that dashboard. Okay? So data is basically shown as SQL even though it started as FHIR. Okay? And they can do it and continue on and on. Just a second. Next one. No? How do I stop it and go to the next slide? There it is. So first of all, let's speak about the benefits. This is the fun part, okay? Of course, there are great benefits from the use of the FHIR SQL builder. First of all, you can get analytic data out of your FHIR repository, okay? Pretty obvious. The second one is you can use SQL tools and use people who doesn't have any FHIR knowledge, okay, which is, in our days, easier to find people with SQL knowledge than people with FHIR knowledge. Okay, so once you decide which kind of information you want to expose out of your FHIR repository, the person who would get those tables doesn't need to know what was the origin. Okay, he has those SQL tables, he can design whatever things he wants to design out of those tables. Okay, so you can expose it to a larger developer audience without having FHIR knowledge. The third thing, you can define a projection on every element you have in the FHIR repository, whether it's from the basic standard, whether it's from your own profile, whether it's on collections, whether it's in extensions. Okay? Everything that you have inside your FHIR repository can be projected outside as part of an SQL table. Okay? And then you can do whatever you like out of it. So you're not restricted in getting any information you would like from your FHIR repository outside. After you have those tables, you can do whatever you like because you're in the SQL world. You can define views, you can define functions, you can define store procedures, or you can define anything you have based on those projections. And remember, we spoke about the transformations. So they're not only restricted to one single FHIR repository. You can export them after you've defined them, and you can import them to another FHIR repository instead of redefining everything from scratch, okay, on another repository. So if someone has already created those transformations for you, you can just export it from one environment and import it to another environment and see the same conclusions or see the same analysis based on that. And of course, there were some challenges, okay? Not much, but they were. The first one was the fact that the column was restricted to only 50 characters, okay? It was based on an ODBC restriction, and I'm glad to tell you that in the latest version, it was fixed, okay? But what they did in order to overcome it is use a cast function. Okay, a cast function doesn't have any limitation like common definition, okay? And in this matter, they could expose the information on fields that are larger than 50 characters. Like I said, in the next version, it's already fixed. The second thing were performance issues. The fact is that whenever we expose a collection or an extension, we expose them as an extra table, okay, a subtable. In the SQL world, whenever you join, the more table you join, the performance is going to be lower, okay? You're going to have extensive querying, it's going to take much more time, which is going to decrease your performance. Okay, so we've fixed this as well. Okay, in the latest version, you would have an option to store a copy of the data as part of the index that you're promoting, so you don't need to go to a subtable in order to get that information, and the performance is great. It's 10 times faster than what we had when we saved it as a subtable. But what the Ministry of Health has done is actually create that information periodically and keep it in a persistent table and do all the queries on that persistent table. It's not, the best solution there is, because you're copying the data and you're keeping it again, but it gave them the performance that they needed, okay, in order to have the information. And then they've decided if they want to put that information every 1 hour, 2 hours, once a day, it based upon them. But they did get a solution and were able to show the data quite easily. Apart from that, if you're in this session today, you probably have some knowledge or want to know about FHIR. Okay, we have an extensive list of FHIR sessions. These were the list for yesterday, so if you missed them, there's they're going to be a recording on all of the sessions, and you have the PDFs at the moment already in your Cvent application. Those are the next slides, right, for today? For today. Okay, I'm the first one. I'm going to be on the second one as well if someone want to come and hear us in Riverview. And there are some other FHIR sessions that might interest you till the rest of the conference. And before I go back to the questions, if you would like to give us some feedback, you're more than welcome. Okay, you can do it using the Cvent application. Okay, and if you want to sign for an early access program, meaning you're going to have access to things we expose before we get it out in the actual version, we would love to hear your feedback on that. And according to that, we might change aspects of the features we're going to implement in the next project. Any questions? Yeah.
Between all the transformations, projections, lose indication, or will you manage to capture everything through the extension?
No, you get all the data that you decide to project. For example, if I have, I don't know, 50 elements in a resource, but I want to project only 4 out of them because all the other are not relevant or they don't have any data in it, okay? Because not in any resource, a lot of elements can be kept empty. It's a decision of the organization what to put in and what not. Most of them are not mandatory, okay? So the 4 you have selected or the 40 you have selected to project out are still there, okay? You're not gonna lose anything in those transformations, okay? They're still there. Yes?
What version was this?
I'll let Patrick answer.
I think the first version of this came out in 2023.1.
Okay. If you're smiling, that means you already have it. Yeah. Okay.
It's the latest version, though.
Yeah.
Because you got that same copy.
Yeah. 2024-2 is the one that will.
2024.1.
Yeah, but the changes. Yeah, in 22-4-2. Okay, so you could wait for that. Any other questions?
Was there a FHIR profile created by the ministry?
Yes, there is an Israeli FHIR profile that we validate against whenever someone keeps a FHIR resource within the FHIR repository. So we adhere to the FHIR profile, and then we keep it, and then we take it out. But the FHIR validation is not concerning the SQL projection, okay? It's done before even keeping the FHIR resource within the repository, okay? The FHIR SQL project starts only after you have the resource kept in the repository, and then you can expose whatever you like outside. Yes?
Is the goal only to have the board of business intelligence board, or is there also some research, artificial intelligence on that?
There are some research based on that and some analytics that are not exposed to the public, okay? And some of the day-to-day decisions when COVID was in its height were made, of course, inside the Ministry of Health and not shared with the public, okay? And it's based on data that has been recorded throughout the process. Yeah. Anything else? Yes?
FHIR doesn't support the merged patient. How do you handle when a patient is merged?
When
Meaning, you have a duplicate.
Yeah. If I remember correctly, the Ministry of Health, well, first of all, in Israel, everybody has an ID, okay? Physical ID, okay? That has nothing to do with the logical ID. And this is the identifier for each one of those resources. So to merge, it probably means that someone has entered the wrong ID, okay? So usually what is being done is, first of all, the current one, which is not current anymore, okay, is being marked as non-active, and you copy all the information of that person and create all that history in the new resource, okay? So you keep everything that you had, but with a different identifier. And it's an extensive work because you need to look at all the other references that you had for that patient throughout your repository and change all of those references. So you need to get all the references of that person, okay, and the person itself, and copy it as a different entity.
No, I understand.
Yeah, okay.
It's a very intense.
Yeah, but it's a FHIR issue, okay? I mean, it would happen whenever you need to create a new resource. It's not something that's specific for them. It's specific for the FHIR standard, because you cannot delete, or probably you're not allowed to delete something, and you need to keep. It's not different from any other. You have an EMR. It's the same issue.
They support merging. When
Oh.
merge is a little bit different.
Okay.
Support links,
Right.
but you have to persist the links in every update.
That's right. Okay. Yeah. But even in the EMR, whenever you merge in the background, you're probably going to copy all the history they had on the previous person and transfer it to someone else. But you can transfer it. You can update that record so you don't copy it. Okay, here you cannot delete something from a FHIR repository according to the standard. You just mark it as non-active. Okay, so there is, if I remember correctly, there is an option to actually delete it, physically delete it, but it's not recommended to be done because you don't have any knowledge of why that person is not there anymore. Okay. Yeah.
Do you have any best practice in terms of planning the one-to-many relationship, like the patient has a multiple address,
Mm-hmm.
and do you normally kind of denormalize the record, like a multiple record, or we kind of have a one-patient record?
It depends what analytics you want to get out of it. And then you decide, yeah, use case. Yeah. Yes.
Hi, Keren.
Hi.
It looks like a different project for Israel Ministry of Health to provide a cross-organizational meeting. So
Okay.
you kind of collect all the availability time slots from different health medical
Mm-hmm.
organizations around most of Israel, and then finally put it on file.
Okay.
We have some suggestions how to do it because FHIR originally wasn't built for support booking, yeah?
Mm-hmm.
It wasn't for medical information.
Right.
So with whom could I discuss our improvements, performance improvements for cross-organizational?
Well, if you're querying FHIR, okay, the underlying data is sitting in FHIR, okay? And so you're looking at encounters, for example, or you're looking at a patient, and then you get the information. So if it's easier for you to do it in SQL, okay, and just congregate all the information in SQL tables and then query everything together, it might be easier than going to a different FHIR repository one by one and getting the information. So that might be an issue. Okay, so you can just gather all the information and keep it in a persistent table with all the other information, then query only one table instead of merging or taking the information.
This is what we do. We have our proprietary interfaces for cross-organizational.
Okay.
What
Sorry. I'll speak with you later. Thank you, everybody.